Hi everyone, I'd like to introduce our project to you, which has the formal title Implementing Principles of Health Literacy into Rehab Practice using a Change Champion Co-Design Approach, a pilot and feasibility evaluation. We refer to it in short as the Health Literacy in Rehabilitation Project, and Jessie Mitchell has created this great project logo for us that you can see in the right hand corner. A little bit about the background. The SEED project has been funded at a time when the value of health literacy is being recognised across the health system. In September, Metro South Health released a statement of organisational commitment to supporting the health literacy of our patients. In disability and rehabilitation, health literacy is an essential component of the understanding necessary for people to exercise choice and control over decisions that affect them. And of course, this is true more broadly in healthcare delivery as clinicians enact models of shared decision making. I'm pleased to say that Danielle Muscat from the University of Sydney Health Literacy Lab is a member of our project team. Danielle has researched health literacy implementation amongst allied health professionals. She's found that training in health literacy does result in changes in verbal communication, but doesn't always translate into written communication in practice. It's this problem with translation that has prompted our Health Literacy in Rehab project. We hope to bridge the implementation gap by adopting a Change Champion co-design approach, which will support the development of a bespoke health literacy toolkit, which is designed for the team that is going to use it. So the SEED grant is supporting a pilot project, which is being undertaken with the clinicians in the spinal outreach team as our co-design participants. We'll first conduct an audit of the health literacy needs of SPOT. We'll use the results of the audit to co-design a bespoke health literacy toolkit. And finally, we will undertake a trial of the toolkit. We're going to put lots of support mechanisms in place, which we hope will increase the likelihood of successful implementation. These include the research team providing the project coordinating functions and facilitation of co-design processes. We'll have the input of a health literacy expert group, all of whom were part of the SEED grant process. Our existing SPOT service user panel members will provide lived experience input, and one of our team members in SPOT, who's a clinician, will act in the capacity of Change Champion. We're going to evaluate the pilot by doing pre and post testing of individual health literacy skills, but also organisational readiness to support health literacy. The SPOT clinicians will be doing a short weekly collaborative journaling session to record their thoughts about the project during key stages. And finally, we'll do a survey at the very end of the toolkit trial to see how SPOT clinicians felt about the whole process. It's quite a big team supporting this co-design process. Our academic supervisor is Patria Cornwell. Myself and Susie Stoikoff are the research coordinators. Our embedded change champion is Michelle Myberg. Of course, the co-design participants are the members of the spinal outreach team. Melissa McElligott from Abios is going to coordinate the consultancy from the health literacy expert group, all of whom are listed there. Sarita Shaw's from SPOT's going to be the panel coordinator, and of course we'll have the input from the SPOT service user panel. Progress to date. Well, currently we're waiting on our final ethics and governance approval so we can begin preparing for the pilot in January and make a start on the actual co-design process in February. We can't be certain how long the audit, co-design and trial implementation is going to take, but it's important that we work in around the regular team meetings and service development activities of the clinicians so that we can prevent there being any additional burden or disruption for the team. And we hope to have the bulk of the work done in 6 to 9 months. Of course, this is just a pilot trial, and the aim is to finesse the process and roll it out to other teams. As such, we'd like to hear from you if you are part of a team that might be interested in being supported to create your own bespoke health literacy toolkit. Thank you for listening, and in conclusion, we'd like to acknowledge the funding support being provided by the Motor Accident Insurance Commission via the Hopkins Centre.